Thank you, Speaker. This MPI today is about anger at public healthcare failures, and it speaks to a system that exists to protect us from avoidable pain and trauma and loss of life. And it speaks to the anger that's felt when parts of that system fail. I listened to the speech by the member for Gembrook earlier, and it was he provided a compelling, harrowing account of a system that sounds like it needs improvement. And I know the feeling that he was describing, not exactly, but in a similar vein. I've sat with my brother multiple times during seizures when he stopped breathing and started changing colour and slipping away. I've sat on the back veranda with my 3-year-old as he goes into anaphylactic shock. And in each of those cases, the ambulance arrived in time. And I can't imagine the pain and the anger of not being able to get through and of having no one answer the phone and watching a loved one die before your eyes. And I think the member for Gembrook expressed the distress that those families are feeling. And he was angry. And I get it, because when it comes to anger about being shortchanged on healthcare, my community has that T-shirt. We know that feeling well. We know what it's like to be left out in the cold on these matters, to be ignored, to be dismissed, singled out and gambled away. This is a broad-ranging debate, but I can give a specific example of anger at public healthcare failures. For 20 years, Mildura had Victoria's only privatised public hospital. It was a disaster for staff and patients, and just like the ambulance crisis, it cost lives too, and that made us very angry. And let's not forget the environment in which Mildura Base Hospital was privatised, an environment where hospital funding right across Victoria was slashed and many hospitals were closed altogether. These cuts had generational impacts on our health system's ability to cope, especially in isolated regional areas. And as the member for Melton, a former paramedic, pointed out earlier, the state is still recovering from that. And that public healthcare failure at Mildura Base Hospital made Kevin Chambers very angry too. He was a much-loved and deeply trusted local surgeon, internationally renowned, and in 2012 he blew the whistle on the failed experiment. The community jumped on board because they were angry too. They needed no convincing that this was a public healthcare failure because they lived it. The government at the time was aghast that the people of Mildura could be so ungrateful and so mean to such a nice company. The nice company that cut Dr Chambers access to the theatre for daring to criticise it. The nice company that maliciously had one activist demoted from his job at another organisation simply for stating his opinion. The nice company that threatened a local mum with legal action for questioning them on Facebook. And the nice company that was supported and defended by the government of the day. When one local activist, Alona Legan, who was dying of cancer at the time, outlined her concerns on our local MP's Facebook page, her comments were deleted, and that made us very angry. The public fight to reclaim our base hospital was strong and sustained. Yet after months of threats and reprisals from the private managers and their political allies, the deeply unpopular contract was renewed, and that made us very angry. The announcement that the spectacular healthcare failure on our doorstep would be extended was reported on the front page of the Sunraysia Daily, and members of the government of the day flashed triumphant smiles to go with their backslapping interview. So we are very well acquainted with the themes of this MPI, with feeling angry about public healthcare failures. And we agree that a government that fails to fix any part of a healthcare system that needs fixing commits a grave dereliction of duty and is beyond redemption, because nothing can redeem a government that in 1998 and 2013 signed and re-signed us up to a patently inferior model of hospital care, a model that it knew or ought to have known was putting lives at risk. Nothing can redeem a government that ignored the warnings of a great man like Kevin Chambers. Nothing can redeem a government that disregarded the testimony of cancer patient Alona Legan. Nothing can redeem a government that ignored the compelling advice of the AMA, specialist doctors, nurses, surgeons and hundreds of patients. And nothing can redeem a government that ignored not only the basic healthcare needs, but the voice and the democratic will of a good, decent, hard-working community whose children are as valuable as yours, whose elderly are as valuable as yours, whose loved ones are as valuable as yours, and whose lives and dignity should never have been gambled. So in light of all of that, I thank the member for Gembrook for providing this platform to talk about the importance of public health care and the responsibility of a government to step up when things need fixing. The question on my mind is whether this government can better the standards set by the previous government on that front. And based on my experience, and perhaps assisted by the fact that the bar was set so embarrassingly low by the previous government, I have faith that this government can and will. Because undisputedly, this government has a good record so far, at least in relation to Mildura. For example, when we raised with this government the problems of our hospitals management model, this government gave our hospital back. When we raised with this government the problems with our hospital building, this government gave us a $2 million master plan. So I'm optimistic that when we raise with this government other problems that need fixing, like GP shortages and paramedic wait times, it will listen and help us. And it's in this spirit that I raise with the government in this MPI today a couple of distinctly ambulance-related issues that we need fixed. The first problem that I'd like to raise with this government is that the Arimple ambulance station is not fit for purpose. It is run out of a former council building. Ambulance Victoria owns the building, but it doesn't own the land, which is likely owned by the state government in some capacity, we think. Our local ambulance team has said that if the government could transfer ownership of the land to AV, then they could sell the entire package and use the proceeds to build a brand new fit for purpose station. That would not only help the existing staff do their jobs better, but also enable the team to expand. And additional paramedics are needed given the rate of population growth in our region. The second problem that I'd like to raise with this government is about GP shortages in our small towns. In this case, ambulance services are not the problem as such, but part of the solution. The solution I'm referring to is the Victorian Government's Advancing Paramedic Roles Implementation Pilot, APRIP. The APRIP pilot has been a hands-down game changer in Oyen and will be hugely beneficial in Robin Vale, a town that has long struggled to get the level of essential services it needs due to the actual population being more than double what has historically been captured in census figures. The point is that the APRIP program expands the role of paramedics to include some of the basic functions of a GP. It's designed to be a convenient stopgap for small towns where the task of finding a permanent GP can take some time, and the program is receiving rave reviews. The Paramedic Community Support Coordinator, appointed to participate in the trial in Oyen, has been instrumental in reducing the amount of unnecessary patient transfers to Mildura. And that's meant that patients have been spared the inconvenience of an hours-long road trip for relatively minor medical needs. And this has been especially beneficial to vulnerable patients such as kids or elderly people for whom extended travel can be difficult. Our small towns don't expect the world when it comes to healthcare. They know that there are limitations to what can be provided in remote locations with small populations. But what they do expect, quite rightly, is a basic minimum standard of service. Community-based health organisations like Mallytrack do an extraordinary job and do everything possible to recruit permanent GPs, but it's a bloody tough market. And when that market fails, the government has to find a way. And that's why the APRIP program is so important, because it works. But its future is uncertain after 30th of June this year, and that's why we're asking the government to extend the funding, expand the program to other locations and make it a permanent feature of the Victorian Government's healthcare system. As an independent, I have the privilege of being able to say it as I see it. I'm not interested in political party games, but in what's best for my community. I'm here to hold the government to account, but also give credit where credit is due. And in Mildura, this government has been responsible for the biggest step forward in public healthcare in living memory, bringing Mildura-based hospital back to public hands. I also have the privilege of being able to call out hypocrisy when I see it, and having the Liberals and Nationals pretending to care about the quality of a healthcare system is, in my experience, the height of hypocrisy. The Coalition has a big credibility issue when they try to say, with a straight face, that they care about public healthcare. Just ask the people of Mildura.